If you've clicked on this video, chances are at some point you've probably been told that high tops protect your ankles, prevent injuries, or maybe even cause certain ones. And while there's a grain of truth to some of those claims, most of them are overblown and in a lot of cases just plain wrong. And for the purposes of this video, I'm lumping highs and higher mid tops together, and I'm going to define those as any shoe where the collar fully envelops the ankle joint and horizontal high ankle ligaments, meaning it rises above the malleoli, or those two big prominences on both sides of your ankle. So that includes what some brands would call mids, as long as they have full coverage of those structures. I know right now there are just a lot of shades of gray with collar heights these days, but that's where I draw the line in terms of where those mids and highs start acting a lot alike. All right, so let's start with myth number 1. High tops prevent ankle sprains. Now this is the one it seems that everybody thinks is true, but the science tells us a completely different story. Now the studies have shown that the explosive inversion moment leading to a lateral ankle sprain occurs in about 50 milliseconds. Meanwhile, the muscles responsible for stabilizing the ankle, like the peroneals, react in about 60 to 90 milliseconds. That means that the injury has already happened before your body even has a chance to respond. And here's the kicker. The ligaments and muscles of your ankle are far better positioned to stabilize you versus a piece of textile just wrapped around your ankle or tied around your ankle. Remember, the actual injury happens before you see the overt rolling. That happens as a result of the ligament failing. So by the time you roll your ankle, the collar of the shoe has already failed, and at that point what you're seeing is the collar just going along for the second half of the injury. Now this is where it gets a little murky. Depending on who you ask or what study you're looking at, some will say that high tops can have a very mild preventative effect of ankle sprains. Why? Because they provide more sensory contact. That added pressure around your ankle may actually increase your proprioception, helping your brain better track your foot's position in space. The higher collar of the shoe simply provides more data points to your brain versus a low because it's touching more of you, and the richer the signal, the more controlled your movement should be. But then there's the opposite side of that coin. Some sports scientists will argue that your body can become dependent on that extra feedback, just like with an ankle brace, where you actually start relying on them. So when you go to a low or change shoes or just don't lace that shoe up tight enough, your brain doesn't have enough information to keep you safe. So really, either way you slice it, at best, a well-built mid or high top might offer a slightly or mild preventive effect, and at worst, a very, very mild negative one. So if a mid or high top shoe isn't the silver bullet, then what is? Well, from a shoe perspective, it's shape and structure. A midsole that isn't too soft and a lateral flange, also some people call an outrigger, that can stop the sprain before it starts by blocking that initial sequence that leads to the ligament failure that leads to the subsequent roll. And what is more important than any shoe? It's proprioceptive training, balance boards, single leg drills, dexterity work. That's what teaches your body to react before your shoe ever has to. All right, and that brings us to the opposite side of the foot, and that is myth number 2, and that's that high tops give you more support, especially medially or in the arch. When most people think of support, they picture a high top locking the foot in, giving you reinforced structure, especially through the arch or the inside edge of the foot. But even that is complicated. The truth is, the height of the collar has nothing to do with arch support. A high top can be just as floppy, unsupportive, and structureless as a low. If the materials are soft and the midsole lacks proper structure, it doesn't matter how high the collar goes, it's not going to give you arch support. In fact, I've seen plenty of low tops that offer way more real-world support than high tops because they have better internal structure, better containment, and a more stable platform. Now let's contradict that for just 1 second. One legitimate advantage high tops have is just vertical real estate. That extra collar space gives you a little more room to fit a bulky orthotic without popping out of the shoe, especially if you're using a custom orthotic. Maybe it's got a really high medial flange, maybe it's got a really big external post, a bigger heel cup. You know, high tops sometimes can just give you more freedom to work with, but as we'll see in a few seconds, sometimes that isn't even the case, because myth number 3 is that high tops stop heel slippage. Now this is one I hear is almost gospel too. High tops keep your heel locked in better. That's what I hear. Yeah, I mean, on the surface, it makes sense. Higher collar, more coverage, less slippage, but here's what people miss. Heel slippage isn't necessarily about how high the collar goes, it's about what's inside the collar. The shape, the padding, the sculpting, that's what really locks your heel in. You can have a high top with zero internal structure, strategic padding, so your foot just floats around the inside. Or, I mean, you can have a low top with just perfectly sculpted heel pockets and bulky padding in the right places that hug your foot and holds it in like a glove. Now, for sure, there is just more real estate in a mid or high than a low to put padding and more lace eyelets to secure you. But just because you can't see the slippage from the outside doesn't mean it's not happening on the inside. And yeah, although it is really hard to actually pop out of a high top and really decently hard to get out of even a lower cut mid, the deleterious effects of heel slippage, such as poor first step launch, repetitive heel trauma, and abnormal stress on the shoe are still happening, even if all the slippage is happening internally. Focus on finding the right fit shoe for you, which one actually fits the shape of your foot. Focus on the internal padding, where it is and where it matches with your foot. Focus on where the lace eyelets are. Focus on the sculpting of the heel counter. That's what's actually going to keep you locked into the shoe. All right, now myth number 4 is one I'm seeing a lot more now because this injury is happening a lot more now, and that's that high tops will stop, or in some cases people will say high tops will cause Achilles tendon ruptures. And this one's gotten a lot louder in the last few years, especially guys like Durant and Kobe who have busted their Achilles. Now you've got people like Tatum and Dame who have torn their Achilles. You hear all the time now, high tops are causing those Achilles tears. Or you see now, if they weren't wearing lows, they wouldn't be busting their Achilles. But as is the theme in this video, and really with any topic in sports medicine, there is a lot more nuance to it. Because remember, just because you see somebody wearing a mid or a low or even a high and busting their Achilles doesn't mean that's the cause. Correlation doesn't equal causation. What can influence Achilles load is how the shoe changes ankle mechanics. A stiff heel counter, aggressive toe spring, differing stack heights, and an overly soft foam can subtly shift more stress onto the Achilles, especially if you already have tight calves or limited ankle mobility. And while I know it feels like high tops might restrict your movement, especially when it comes to extending or flexing your ankle, the truth is most high tops don't significantly limit dorsiflexion or plantar flexion. Multiple studies using motion analysis and goniometry have shown that traditional high ankle collars rarely affect sagittal plane ankle mechanics in a meaningful way. The restriction people feel is more perceptual than mechanical. It's coming from the contact around your ankle, not actual joint limitation. So when it comes to Achilles loading during more explosive movements, the collar height isn't doing much to reduce or increase that strain. And the effect of the collar is even less once the shoe is broken in, or when there's more elastic or just flexible materials around the collar. And before I get into myth number 5, if you are someone who wants to squeeze every bit of performance out of your shoes, or you're just sick of shoes that don't actually match how you move, I put everything I know about optimizing footwear and orthotics into a full customization and lower leg taping ebook. You can get that in the link in the description below if you want to learn more. And with that being said, that brings me to the 5th and last myth, and that's that all highs, and mids for that matter, are relatively the same. And this one may feel like a throwaway myth, but the concept is actually really important to understand. People tend to treat high tops like they're all doing the same thing, but that really couldn't be further from the truth. So take these two for example. You've got the Adidas Stycon as well as the Nike GT Jump 2. Both high tops. One is a flexible spandex-like structure, and the other uses every millimeter of space to place plastic, wiring, bells and whistles, padding, you name it, inside the shoe. Because yeah, some highs like the Stycon, the 808, the Nike Court Flare use that real estate just to place more elastic, right, to give you more biofeedback. Others like the GT Jump 2, use it to put more bells and whistles on it, like the Jump Frame, which is actually, yeah, that's pretty cool. But I think the thing you gotta remember is high tops are a category, not a solution. And if you want a shoe that works for your foot, your movement, and your risk factors, you have to look deeper than the ankle collar. And speaking of your foot and your movement, if you've seen Luka's recent weight loss, the first thing that comes to mind for a lot of people probably is, yeah, this is gonna save his knees, make him a better defensive player, keep him fresher longer, which yeah, that's all true. But that weight loss also could do some weird things to his step back. And if you want to deep dive into the mechanics behind his step back and how it correlates to body mass and his body mass specifically, check out this video up above and make sure you subscribe down below. I'll see you in that video.